Now, a woman from Milton Keynes is calling for the NHS to do more to stop the spread of variant CJD, or mad cow disease. Liz Green is a haemophiliac who herself is on the at-risk register, but says she's chosen not to be told if she has it for sure. She's already contracted hepatitis C from infected blood brought in from America in the 1980s, along with thousands of others. She told our reporter Tony Fisher that she doesn't want variant CJD being passed on via blood transfusions.
It's now become evident that that is in the British blood supply. At the moment, there is no test for the presence of CJD in blood. It is my understanding that there is a blood test which is available on the continent, but at the moment, we don't have one available here. And as there are now upwards of 15,000 people in our population, according to the HPA, who could be silent carriers, that's an awful lot of people walking around, possible donors who are putting blood into the main system. Anyone having an operation or anything like that is at risk, because a lot of these people, because they're silent carriers, they have no idea that they're carrying this disease in their blood, and it's then passed on to the next person who could be incubating it for 2 years or 5 years or 20 years, and it's like a ticking time bomb waiting to go off.
But the NHS, in their defence, although they admit there's currently no blood test for CJD, or at least presumably in this country, they are doing various things to try and limit the passing on of contaminated blood with CJD, aren't they?
They're not really doing very much. All they're taking out of the system is a donor who later developed CJD, or any products that have been obtained from that donation is taken out of the system. They're saying here white blood cells, and then it says which may carry a proportion of the risk of transmitting CJD. Well, that's just a may, isn't it? They don't really know. And the other thing is that exclusion of donors who have received a blood transfusion since January 1980. Well, what does that tell you about blood since 1980? It's more or less saying to you that anyone who's had a transfusion since 1980 is at risk of having CJD. That's why they're not putting them into the blood donor panel. It speaks volumes.
What would you like them to do? You would like to see a proper blood test,
Yes.
presumably, for CJD in this country?
Yes, definitely. As I say, it's my understanding that there's a blood test which is available on the continent, and why can't we have it over here? Because then at least we would be able to screen people who are carrying the disease, and at least it would stop even more blood being infected with it. I mean, it's obviously got to unacceptable levels now.
You say this is a ticking time bomb, and if we believe the Health Protection Agency, who say that there are possibly 15,000 silent carriers out there, the implications are pretty enormous then.
Yes, they are. Again, it's my understanding that just recently 5,000 letters were sent out across the UK warning people who have given blood in the past or have been recipients of blood or medical procedures that they're at risk of CJD. They really need to get their act together and do something about this. Otherwise, everyone in the country is going to have to pay for eventually, socially and economically.
It seems that the NHS is just acting too late on all of this, really.
It is, yeah, like it acted too late with HIV and with hepatitis C.
That's Liz Green from Milton Keynes, who's a haemophiliac, who's on the at-risk register for variant CJD. The NHS says it has every sympathy for the patients and families affected by infections transmitted by blood and plasma products in the 1970s and 1980s. NHS Blood and Transplant, NHSBT, takes blood safety extremely seriously and has introduced many measures to ensure the safety of donors and patients alike.